The National Market Development and Quality Forum is to bring together all the people engaged across the sector, people with lived experience and their carers, providers of social care services, commissioners of social care services and other wider partners like my own organisation, Skills for Care, to look at how we can best work together to make sure that people living in local communities can access the care and support they need in a way that's easy for them and provides them with the ability to live the life the way they want to live. So we're trying to ensure that there's a good range of high quality, affordable provision for people who have a whole range of care and support needs. What can we do collaboratively to make sure that we do have sustainable provision in that widest sense for people in our communities, and what are the contingency plans for where it's fragile?
And we recognise what a challenging time it is both for councils and for providers, and so within that kind of context the idea of cost sustainability becomes even more challenging, and a really important part of that and important part of commissioning is having an effective and collaborative approach to agreeing fee rates and agreeing the services that can be made available at those rates. So from the local authority point of view, we know that prices have one of the main drivers for the overall bill for social care, and providers obviously are reliant on a viable rate for the services they provide. So there's a real interdependency in how they operate together, and so collaboration is an absolute core part of that. And we know that, I know there's been a guide that the Department works with the Chartered Institute of Public Finance Accounting alongside the LJ and ADAS to support better commissioning decisions so that the market is both sustainable and meets the quality demands that are absolutely essential for maintaining our social care services. Amongst all of this, I think core to all of this, we can talk about all the work we're doing, but absolutely central to it is that focus on person-centred care, because it can all be lost in discussions about price and about exactly what services are going to be delivered and when. If it's not developed and shaped around the person, we kind of lose the point. So that's got to be at the heart of what we do.
I think in terms of sustainability, well, I think we all know how fragile much of the sector is. We report regularly to the Department of Health about the trends and about the pinch points in the system.
There is limited personal development. So, okay, Mary was one of our personal assistants when I started working, and I was doing less of the staff rotoring and those sorts of things. Mary took on that role, so you would sort of see that as a managing role. But apart from that, when it's a direct employment, there is limited progression within an employment point of view from a direct payment. I've said less qualified doesn't mean poor quality, and how can we introduce standards without choking individuality and less formal arrangements, and recognition for an informal training. So do you remember that training that I was telling you about, that's around person-centred planning, community connecting, resource making? Again, extremely valuable, and certainly when the PAs left myself and they went into other care providers, into other people's homes, they took that training with them, and obviously it was experience on their CV, but it didn't have any weight as far as a qualification is concerned. So it would be nice to actually see that turn into a qualification.
Provider failure is happening, and it's happening all the time. 75% of local authorities we surveyed had experienced a major provider failure in either domiciliary or residential care within the last 12 months. 75% expected to experience at least one more within the next 12 months. So it is happening, it is a very real thing. It seemed to be the more interesting stuff in some ways was around the sort of market management and market planning to try and avoid provider failure, where again we found there was perhaps less sort of thinking had gone on. There's quite a lot we can do in terms of how we manage the commissioning process. Outcome-based commissioning properly done gives you a flexibility that can help compared to sort of time and task commissioning. So that does seem to be a big part of the answer, but it remains something I think that as a sector we're insufficiently adept at.
So if we just look at the number of plans around, so we've got sustainability and transformation plans, we've got better care fund plans, and we've got transforming care plans. So say we're advising a local small learning disability home, where would you suggest they start really in terms of working with all these different plans? Is it worth it? Should they engage early? How would they do it? It's very difficult when you're a small provider in terms of engagement and capacity to do all of that. And there always seems to be something new in the system that you've got to adjust and learn to.
So, Anne, I think you're absolutely right. I think it's not just a challenge for this sector, but there's other sectors where there's lots and lots of small businesses, and the challenge, particularly frequently the way that government or statutory organisations work, is that they don't necessarily think about how they can address their consultations to a variety of different audiences. I think where to engage is an interesting question, and the sustainability and transformation plans are over a larger footprint. So I think there's a question as to if it is a micro business or very small business in a very small footprint, where to engage with that, whether that's through the local council or through the broader sustainability and transformation plan is an interesting question I'll certainly come back to you on. But I think probably the most important thing as well is the valuable role that representative bodies play in this, and in bringing together the voices of lots of small businesses and understanding the differences in different regions and localities has a huge role and a very strong and important role in not just developing national policy but also influencing what's happening over those 44 STP areas. And I'll get back to you on some of the how as well.
A question for CQC around when they do register a new organisation. Do they ask questions around the business planning? Because it seems that many businesses, home care particularly, think that local authorities are just going to pass lots of business their way. And I just wonder whether there's an early question, conversation as part of the regulatory process with organisations to say, have you considered your business plan?
In terms of registration, clearly the role of the regulator is not to keep services out on the basis of whether they've got a viable business plan or not a viable business plan. They will go straight to tribunal and they'll undoubtedly win. I think we can ask the question, have you thought about where your business is going to come from? Because I think the tone of this question is, we don't want people to start using a service which is then going to fold on them and leave them in high and dry if that can at all be avoided. But as I say, the role of the regulator in terms of regulating entry is to ensure that due diligence tests have been taken, that the service is capable, can demonstrate that capability in order to be delivering the service. And I think our view would be that a provider wishing to enter has got the responsibility themselves of ensuring that there is a demand for that service in the marketplace. I would caveat that with clearly, when it comes to some types of service for people with learning disability, the long stay hospital, the treatment and assessment process is an area that we've been clearly mandated to try to reduce and ensure a reducing amount of market in that area. But I think that's a very specific area. And one that I think there is general consensus about, that we wish to reduce that amount of availability and stimulate alternatives. That having been said, I think again it is still a challenge where providers by and large feel that they have the right, if they are registerable, to decide what sort of business they want to offer, and then it comes down to commissioners and citizenry as to whether that's a service they wish to buy.